pregnancy may be unpleasant at times. You might be experiencing morning sickness, heartburn, or swollen ankles. But what about hand and wrist discomfort, numbness, and tingling? If you experience these symptoms, you may be suffering from carpal tunnel syndrome, CTS. CTS is a common pregnant ailment that is rarely discussed. Here's everything you need to know about the origins, symptoms, and management of carpal tunnel syndrome during pregnancy. What are the signs and symptoms of pregnant carpal tunnel syndrome? The following are some of the most common symptoms of CTS in pregnancy. Numbness and tingling, similar to pins and needles, in fingers, wrists, and hands, which may increase at night. Throbbing in the hands, wrists, and fingers. Fingers swollen. Problems in gripping items and fine motor skills, such as buttoning a blouse or working the clasp on a necklace. It is possible that one or both hands will be affected. According to a 2012 research, nearly all pregnant individuals with CTS experienced it in both hands. As the pregnancy continues, symptoms may intensify. According to one study, 40% of patients reported the start of CTS symptoms after 30 weeks of pregnancy. This is the period of greatest weight gain and fluid retention. During pregnancy, how early may you get carpal tunnel syndrome? The majority of pregnant women who suffer from carpal tunnel syndrome report discomfort and numbness in the third trimester. However, symptoms can appear as early as the first trimester. What relieves carpal tunnel syndrome during pregnancy? The more you can do now to reduce the symptoms of carpal tunnel syndrome, the more likely you will be symptom-free after giving birth. Here are several solutions. Consider using a wrist brace. If your carpal tunnel syndrome is causing you a lot of discomfort, ask your doctor to suggest a wrist brace. You may be able to find one at your local pharmacy. Then make sure you wear it during the day and at night. According to one research, utilizing one helped 80% of pregnant women with carpal tunnel syndrome. Stretch. Take regular hand stretching pauses if you work at a computer or perform any other job that demands repetitive motions, such as playing the piano or filing. Take your place. If you spend a lot of time typing on a computer, ensure your wrists are straight and your elbows are higher than your hands. You might also want to consider purchasing an ergonomic keyboard that is intended to protect your hands and fingers. Allow yourself to sleep freely. Don't squeeze your limbs during night. Avoid sleeping on your hands and prop up your arms with a pillow at night. Get your blood pumping. Frequently shake your hands and wrists. Shake your hand over the edge of your bed at night. Limit your intake of salt. Reduced sodium and salt intake can help reduce edema and water retention, both of which aggravate carpal tunnel syndrome. Examine alternative treatments. Acupuncture may be able to alleviate hand discomfort. Request a referral from your practitioner. Inquire about medicine. Inquire with your doctor if nonsteroidal anti-inflammatory drugs, NSAIDs, or steroids, which are commonly recommended for carpal tunnel syndrome, are safe to use during pregnancy. Is it possible to get rid of carpal tunnel syndrome during pregnancy? Carpal tunnel syndrome symptoms generally fade after birth as pregnancy swelling subsides. However, it might take up to 6 weeks for everything to return to normal. However, if it persists after that, consult your doctor.